talk about eosinophilia. So, pulmonary eosinophilia occurs when the eosinophilic count exceeds 0.4 into 10 raised to power 9 per liter. So, this term is applied to the clinical disorders of different etiologies in which lungs produce radiological abnormality associated with blood complications. Now, basically, it occurs when it is more than 0.4, and it is a term which refers to a broad spectrum of clinical disorders of various etiologies. Also, they manifest as radiological abnormalities associated with blood complications. Now, coming on to the classification. In classification, we have the intrinsic and the extrinsic. For intrinsic, drugs such as nitrofurantoin, then sulfadiazine, imipramine, then certain helminths or parasites like Ascaris, Toxocaria, even fungi, Aspergillus fumigatus. Now, this is the extrinsic. Now, coming on to the intrinsic. In intrinsic, we have eosinophilic pneumonia, then we have hypereosinophilic syndromes, then we have polyarthritis nodosa. Now, coming on to the causes of eosinophilia. So, the causes, to remember the causes, remember charts of PM. Okay, so by C, we have collagen vascular diseases such as rheumatoid arthritis, polyarthritis nodosa. By H, we have hypereosinophilic syndromes, Loeffler syndrome, or idiopathic. Then by A, remember allergic conditions such as hay fever, allergy to certain drugs, aspergillosis, asthma. Then by T, remember tumors. In tumors, lymphoma. By S, remember skin disorders, eczema, psoriasis, dermatitis herpetiform. Then by P, remember parasitic infection. Also by M, remember miscellaneous like sarcoidosis, Addison's disease. Now, coming on to the clinical features. In clinical features, what you get to see is you get to see dyspnea, the chest pain, then orthopnea, then wheezing and cough, hematosis, dyspnea, orthopnea, wheezing, cough with mucoid expectoration, hematosis, chest pain. Then in investigation, X-ray of chest is done, which will show us diffuse mottling on lungs. Then for severe, you can do sputum examination, also blood eosinophilic count. Now, coming on to the treatment part, there is basically corticosteroid therapy that is given. Now, to make it more understandable, so there are types, then there are symptoms, then blood eosinophils, then multi-system disorder or involvement, then duration, prognosis. Okay, now I told you there are different types. So to remember the types in this table, just remember cat HB. Okay, so first type is cryptogenic pulmonary eosinophilia. Then by A is asthmatic bronchopulmonary eosinophilia. Then by T, remember there is tropical pulmonary eosinophilia. By H, remember hyper eosinophilic syndrome. By P, remember polyarthritis nodosa. Now, these will be having mild to moderate symptoms. Moderate, then tropical will have moderate, hyper eosinophilic will show us severe, and poly will also show us severe. Now over here it is 15 to 20%, 15 to 20%. This is more than 20%. This is also lying between 20 to 50%, and this is 20% more. So multi-system may this and this will always be involved, the last ones. Now coming on to the duration, this is for 1 month to years. Then similarly all of them. Then this will have good prognosis, this will have fair, this will also have fair, this will have bad prognosis, and polyarthritis will also have bad prognosis.